Hello and welcome to the online session on hospital pharmacy and its organization. The learning objectives of today's session is, upon completion of this lecture, you should understand what is hospital pharmacy, what are the different types of pharmaceutical services which has been rendered by hospital pharmacist, then what are all the functions which are carried out by the hospital pharmacist. Then we'll be seeing operational structure of a hospital pharmacist with a beautiful illustration, suggested pattern of a setup of hospital pharmacy, and lastly we'll be covering the functions and the roles and responsibilities of the head of the department and the pharmacy and his allied staff. So let us begin the session. Now, coming to the definition of the hospital pharmacy, how we define the term hospital pharmacy. Hospital pharmacy is a department, service or a domain in the hospital organization managed under the direct supervision of a professionally competent, legally qualified pharmacist. And he deals with many of the things. Okay? Firstly, we shall understand the definition in a detailed manner. Hospital pharmacy is the department or a service or any kind of domain in the hospital organization which is directly managed under the direct supervision of professionally competent. The professional word stands for those things, one who is highly educated, qualified, that means he is qualified, having enough skills to handle any kind of task in his range, and later he is competent enough. Competent means he can handle many number of things, many number of tasks, many number of responsibilities at one time. So he is highly competent pharmacist. And he is legally qualified. He is qualified, he is a B Pharm or M Pharm holder. Okay? And he deals with many things. Let us now understand what all the things he is dealing with. Having defined what is hospital pharmacy, now hospital pharmacy deals with many things. Okay? One, the supply of drugs, medicines and allied products to the nursing units and other services whenever required. Filling of special prescriptions for ambulatory and outpatients and dispensing as per the intention of the physician, as per the need or as per the requirement of the physician. Third, manufacturing of the drugs and formulations in bulk and in particular the large volume parenterals which are required for the use of indoor patients. Because hospital will be having inpatients. So the hospital, in big hospitals like Apollo hospitals, Fortis Hospital, Narayana Hridayalaya Hospital, and many hospitals, they have their own large volume parenterals manufacturing. So they prepare bulk drugs in a very huge quantity. And that depends upon the requirement and that depends upon the how they handle the bulk and other things. Storage and dispensing of narcotic and biological products. So they store and they dispense the narcotic drugs and the biological products. Okay, that is one of the main responsibility which has been bestowed on the hospital pharmacist. Proper storage, and we know that all the pharmaceutical products has to be maintained in a proper chain temperature, in a proper temperature. And if you don't store properly, the products may become degraded or it may become spoiled. So it becomes utmost fundamental responsibility of hospital pharmacists to properly store and dispense as and when required, especially the drugs like narcotics and biological products. They require prescriptions. They are prescription products where a large amount of responsibility has been given to the pharmacist to store properly and to dispense those medications only to the required person, only with prescription. Lastly, the supply and storage of ancillary products and articles required in the hospital. Okay. Now here, some of the words are very new to us, so let us understand those words. Okay. Now coming here, filling of special prescriptions for ambulatory. The ambulatory, you can remember the ambulatory services, the ambulation, okay, which is moving always, isn't it? So ambulatory care is nothing but outpatient care. It is also called as ambulatory care or outpatient care. Is a medical care provided on an outpatient basis, including diagnosis, observation, consultation, treatment, intervention, and rehabilitation services. So this care can include advanced medical technology and even procedures, even when provided outside of the hospitals. So ambulatory settings are those care which is given for outside of the hospitals. Okay. So filling of special prescriptions for ambulatory and outpatients. So ambulatory care particularly refers to the care which has been given to the patient outside the premises, outside. So ambulatory care pharmacist will be working outside as per the need of the patient. Okay. So these ambulatory care services has become very, very important. Now ambulatory care, a new word of patient care opportunities. I'll be sending those videos to you. Okay. I'll be sending those videos to you. You can understand in a better manner. And some of the definitions we can understand here, some of the words like ancillary products. Ancillary products or ancillary substances are the products which are dispensed by the pharmacist with main drugs which are prescribed by the doctor. So it carries the auxiliary labels. Okay, ancillary labels or auxiliary labels. Okay, these medicines are given in the combination with the main drugs that may be helpful in the treatment. They may come under the category of parapharmaceuticals. They may include like catheters, needles, several laboratory wares, sutures, syringes, okay, all these surgical items, all these products, they are termed to be as ancillary products, okay. Now, let us move and let us understand other things. Now, coming to the term pharmaceutical services in a hospital comprises of services which has been rendered to the patient through a number of activities. The major are, we will see one by one, which are the pharmaceutical services which has been rendered by the hospital pharmacist in particular. Mainly the dispensing of drugs and medicine as per the prescriptions of medical staff of the hospital for the outdoor patients and as well as indoor patients. Management of the stores, which includes, so management is a very big and broad terminology. So we have to specify the different types of management levels. Okay, what all the management includes here, coming to the pharmaceutical services which has been rendered by the pharmacist. 1. Purchase of drugs and medicines and other allied stores as per the recommendations of the Pharmacy and Therapeutic Committee, P&TC Committee, providing instructions for proper storage of such drugs and medicines, maintenance of proper records of the drugs purchased and the distribution thereof, manufacture and distribution of medicaments and products, the third point. So he is involved in manufacturing and distributing of medicaments and products, such as the transfusion fluids and other parenteral products required by the medical staff, which are not manufactured and marketed. Okay, tablets, capsules, ointments, and other external use preparations. Sometimes big hospitals may have the subordinate manufacturing unit also, and they manufacture especially the large volume parenterals. Okay, we'll be seeing that one. Stock mixtures as per the hospital formulary. Providing therapeutic drug monitoring services, TDM services. So the TDM is one of the important things which happens. We'll be seeing in the TDM chapter in a great detailed manner. The therapeutic drug monitoring is a monitoring of drug, whether it lies in the therapeutic range or not. Okay, the TDM principle says the drug should always lie from minimum effective concentration to the maximum safe concentration. It should lie that in the therapeutic window, then only it can produce desired therapeutic benefit to the patient. So, providing therapeutic drug monitoring services by studying effects of various drugs administered to the patients, especially the indoor patients, from the patient charts maintained in the wards, etc., which has been done by the nursing staff. Okay, the pharmacist activity involves many things, a very broad area. So he provides manufacturing, distribution, dispensing, providing therapeutic drug monitoring services by studying the effects of various drugs. Okay, how the drugs behave in the patients. So the drugs behave especially in the indoor patients. Now charts have been maintained in the wards by nursing staff, and they study the drug is really behavior as per the guidelines, or is there any deviation? Is there the drug is not behaving in the required manner? Something has to be altered. One more drug has to be added, or the dose has to be reduced. Okay. For example, in the index cards of requisite size and maintaining this information in the hospital drug information bureau or center. Okay. The drug monitoring services are also provided by studying the samples of the blood. Okay, the drug monitoring services, they'll be taking the samples of the blood or the sputum samples, then they determine the level of drug present in the blood, that is concentration of the drug in such samples. Okay, and they will understand how the drug is acting in that patient, how the drug is behaving. They may conduct whether the drug is crossing the maximum range, that is the maximum safety concentration range. I'll be telling you in a great detail in therapeutic drug monitoring. Nextly, establishment and maintenance of drug information center. The drug information center is a very good, is a very great thing for giving services to the patient as and when required. So, any three words split up into three words in sentences: maintenance or establishment of drug information center, drug information and center. There is center which gives information about drug, whether it may be in a new drug which is just newly launched in the market, where the information is not known to the physician or the particular doctor is asking any information. That time you have to provide the valuable information to the doctor regarding about its dosage, side effects, adverse effects. What are the precautions has to be taken while giving the drug therapy to the patient, where it has to be avoided, special precautions. Okay, all this information will be given by the drug information centers, which will be located in the hospitals. Patient counseling service. While supplying drugs, especially from the outpatient department, you have to render one of the important tasks is patient counseling. You have to counsel the patient in terms of many things. Again, separate chapter for you about patient counseling. So, in the patient counseling, which becomes a fundamental responsibility which lies on the pharmacist's shoulder. Patient counseling, the faculty members like doctors, they do. Then nurses, they do patient counseling. Pharmacist also does the patient counseling. The pharmacist, with his valuable information regarding about the drug and the side effects of the drug, not only drug, he can give the pills to the patient. Pills, not only that pills what we are giving to the patient, PIL stands for PILS, which stands for Patient Information Leaflets, which will be written in local languages for easy understanding and for easy remembering all the things, so the patient can read in the local language, which will be written in the local language. The pharmacist can give the valuable suggestions to the patient in case of obesity, in case of hypertension, in case of diabetes mellitus, in case of arthritis. The patient counseling can be given regarding about the disease. The patient counseling can be given regarding about the drugs. Any kind of counseling regarding about the usage of drugs. Okay, possibility of side effects which have been associated with particular drug therapy. How to overcome that? When to take the drug? What happens if the dose is missed? All these things can be given. That terminology is called to be as patient counseling. You're counseling with the patient. You're taking one of the important time with the patient and you're making arrangement that the drug has to give maximum benefit to the patient. Okay, with minimum toxicity. Maintaining liaison with the medical staff, nursing staff, and the patient themselves. So the pharmacist, he's having a liaison. He maintains the coordination. He communicates with the medical staff. He communicates with the nursing staff. He communicates with the patients. He's the first point of contact. If you go to the community pharmacy, let me tell you about the community pharmacy. In the hospital pharmacy, I'm telling you about community pharmacy. I say the community pharmacists are the first point of contact in case of many things. Many times during certain minor ailments, I'm telling minor ailments, not the major ailments, only in case of minor ailments, the first point of contact will be done by the community pharmacist, where he is giving the valuable information regarding about the drug disease and whatever information it may be about even dietary factors also. So he's working and he's doing his work in coordination with the medical staff. He's like a supportive member and he's a link member. He's providing a link between the patient, pharmacy, all the subordinate staff, nursing staff, and even the patient themselves. Okay, he provides that contact. Okay. To maintain the nursing department and the central sterile supply in the hospital. So nursing department, whenever they require any kind of the sterile things, okay, the sterile supply, there is a central sterile supply unit in the hospital which will be supplied by the pharmacist who is in charge of sterile unit, okay, for the preparations of parenterals, for the preparations of large volume parenterals, okay, where the sterile area is required. So these pharmacists who are well versed in sterile region, aseptic conditions, they maintain that department. They work well with coordination with the nursing team. Participation in teaching programs of the nursing and the pharmacy students. They participate, the pharmacist here, one who is having a very great knowledge, especially the M.Pharma in pharmacy practice, M.Pharma in pharmacology, PharmD, after completion of PharmD, again, we have the privilege to attend the board certified programs like oncology, okay, fellowship in oncology, board certified in oncology, or the fellowship programs in nephrology. Okay, these are all the board certified programs or residency programs, I should say residency programs, which makes the pharmacist to upgrade his knowledge in a particular thing. So a medical term or the pharmacy itself is a very vast term. Okay, there are different branches, different specializations existing. So no one cannot become perfect in all the branches, isn't it? It is hardly impossible task to become a master in all. Okay, so one has to become specialized in particular area or in particular branch or specialization. So you can do mastery in that subject. So you become thorough in that. You have a very good knowledge. You develop a skills in a very satisfaction manner. So the skills which has been implemented into the practicality. You can implement those skills which has been learned by you. You can implement those skills during the residency programs, and when you implement those skills practically, you not only you provide satisfaction to the patients, you provide the whole care, the patient care, which is one of the foundation basis for all the medical things. Okay, the patient care. So the pharmacist is involved in many activities like teaching to the nursing staff or teaching to the junior pharmacy students. Now we shall understand and we shall know about which all the functions of a hospital pharmacist who carries in the hospital. Okay, this the question may be asked in the exam. What are the functions of the hospital pharmacist? You should understand what all the functions which has been carried, or which functions the hospital where hospital pharmacist will be carrying these type of functions to manage the hospital. To provide and evaluate pharmaceutical services and thereby supporting the medical staff with due consideration of the objectives and policies of the hospital. So he provides and he evaluates the pharmaceutical services. Very important services of the pharmacy, that is pharmaceutical services. Again, itself is a very big thing. I'll be explaining you in the later slide. Okay, and thereby supporting the medical staff. By providing the pharmaceutical services, he is supporting the medical staff. He is supporting the nursing staff. He is supporting the allied staff with due consideration of the objectives of the policies of the hospital. So, whenever he implements, he evaluates, he conducts the pharmaceutical care to the patient, he stands always with the policies which has been framed by the hospital. He always restricts himself within that framework. Okay, but all the objectives or the policies which has been framed by the hospital, he always stick to the principles of the policies. That is the guidelines which has been given by the hospital. To draw a plan for hospital pharmacy administration and to evolve responsibilities of each category of personnel involved in pharmaceutical services, such as assistants, pharmacy assistants, storekeeper, nursing staff, etc. Okay, so the pharmacist involved here, what he does now, he draws a plan. A planning is very much required for doing any type of work. Okay, in a small work, a proper planning will always give you a fruitful results. Okay, so he draws a plan for hospital pharmacy administration. He manages, he plans that administration policies, whatever it may be, then he implements those plans to move in a proper direction. Okay, planning is required. He plans in such a manner that for efficient, smooth administration of the hospital, he plans in such a way that all the things should go as per the planning. Okay, and to evolve responsibilities of each category of personnel involved in pharmaceutical services. And he manages all the things, whether it may be the pharmacy assistant, assistant pharmacist, storekeeper, nursing staff, some other non-technical staff. Okay, all these things, they work in coordination with the pharmacist. Okay, he has to take care of all the things, whether it may be the pharmacy assistant or storekeeper, nursing staff, etc. Again, same thing. To he establish the main purpose of or functions of the hospital pharmacist. He establish the liaison between administrative authorities. He may be the director, he may be the superintendent of the hospital, medical superintendent of the hospital, or he may be the board of trustees, managing trustee, etc. He maintains the relationship with all the things, and he will coordinate all the things for proper functioning of the hospital. Okay, and whatever the things it may be, whether it may be related to the order, medicine supply, purchase, or billing, whatever to purchase anything, which all the quantities, money things, the monetary benefits, all the things he will discuss with the higher teams or director or superintendent, who is the chief of the hospital. And he devotes what all the things which are happening in the hospital. He gives the information to the administrative authorities, which where the information is required, and he's giving all the information. He's working like coordination team with all. To estimate the requirements for the department and enforce the policies and procedures for the recruitment of adequate and competent staff. So, whenever to run any pharmacy, a sufficient staff should be there. A department should contain staff. Okay, that staff should be competent enough, or the staff should be enough. Adequate means enough, that there should not be any lagging of time. When the patients waits over the corridor in the hospital, it should not become like a messy thing. Okay, so a sufficient staff should be there, and the recruitment of staff, handling of staff, and managing of staff will be done by the hospital pharmacist. Based on the qualification, based on the experience, based on the skills what he is pertaining, he will be assigning those duties for those pharmacists. Okay, so he is an estimation. He estimates the requirements based on the department. Okay, he estimates which all the requirements are necessary. Based on the requirement, he takes the decision and he enforces certain policies within his reach, and the procedures, which all the procedures for the their hospitals will be having separate procedures for the recruitment of the staff. Okay, every hospitals, like if you go to the Apollo hospitals, Fortis hospital, then Narayana Hridayalaya hospital, healthcare global hospitals, many government hospitals, they have their own policies and they have their own procedures for the recruitment of the staff. He will always stick to the principles of that policies, and he will see to it that that will be always kept in the mind before recruitment of any staff for the handling of the pharmacy things. To provide the means and methods by which personnel can work with other groups in interpreting the objectives and policies of the hospital. So he provides means and methods. So there may be many persons who will be working in the hospital. He provides interlink and he interprets the things and objectives of the policies. So many times I told you that hospital pharmacist always in many situations what happens, especially it happens in the abroad scenario. Let me tell you, in abroad scenario, the hospital pharmacist is a very key person. He works like an administrator over there. Probably he may have one qualification with MBA. Okay, he will be having MBA qualification, and he is the main person to carry out all the monitoring units, whether to conduct the pharmacy and therapeutic committee meetings, whether to purchasing and billing orders, a bulk quantity, what has to be done, management of the employees, even doctors and medical sales representatives, and how they meet the hospital administrator rather than the doctor, which products has to be kept in the hospital, and a liaison team, and interpreting the objectives and policies, which all the policies has to be made in the hospital. Even he becomes like decision-making authority, because medical superintendent and the higher authorities cannot decide. They don't know the ground realities, actually, what all the things is happening in the hospital. But this hospital administrator, he can frame policies for the welfare of the hospital, for the upliftment of the hospital. Okay? To develop and maintain an effective system of clinical and administrative records and reports. He develops and maintains an effective system of clinical and administrative records and reports. He is a main person to develop and to maintain an effective system. Okay, he is working in the system, and that system has to be followed. I'm telling you, please listen to me, understand. And he develops the effective system of clinical and administrative records. Okay, whether in case of any clinical records, any administrative records or reports, it becomes the fundamental responsibility of the pharmacist, hospital pharmacy in charge, that he has to maintain the documentation. He has to maintain it for a certain number of years. Okay, so he develops and maintain an effective system. Which system? Record maintenance and report maintenance. To participate in and adhere to the financial plan of the operation for the hospital. So he participates and he will be always adhere to the financial plan. Okay, what the financial plan has been given by some of the accountants, like chartered accountants will be there, and these accountants will give you, or some person who is financial analyst will be there, or some person with MBA with financial plan will be telling you about all the activities of the how to manage those things. Okay, sometimes he will adhere and he will stick to. Adhere means he will always stick to the principles of financial planning of the operation for the hospital. So he will always, because it becomes utmost duty of the pharmacist, within the limited range of the budget, he has to purchase the pharmaceutical products. He cannot purchase the pharmaceutical products according to his wish. It becomes utmost important responsibility of the hospital pharmacist. He should stick to the principles of the planning which has been given by the financial advisor. Okay, now he listens to the financial advisor. Again, he's acting like a coordination committee. He goes there and he manages all the things are put into right way. Okay, to estimate the needs for facilities, supplies, and equipments, and to see that there is proper control of inventory. Okay, now it comes now. Okay, he controls the inventory control. Stocks should not be piled up. Okay, it should not become dead stocks. Okay, inventory, the moving and incoming and outgoing should happen in proper manner. Okay, I'm telling you in a very common language. So product has to be moved. Okay, if again he becomes very responsible enough for supply of the services. Okay, proper control of inventory, stocks, dispensing and manufacturing of the medicaments. Okay, to initiate, utilize and participate in research projects designed for the improvement of the patient care and of other administrative and hospital services. So he becomes like initiation to start. He will utilize and participate. He starts, then he utilizes, uses and participate. He himself will participate in the research projects. Design what? For what? These research projects are designed. They are designed for the improvement of the patient care, isn't it? Any research project, it is research work is done for the upliftment of to give the better patient care, patient services in terms of healthcare, whatever it may be. Okay, so he becomes one with the research team and he guides them, and sometimes he joins with them and for the improvement of patient care and other hospital or administrative services which has to be done by him. Okay, he becomes like inception member, initiation member. He participates and adhere to the safety programs of the hospital services. Whatever the safety program is initiated by the hospital, he becomes the key person. Okay, the hospital, the main revenue from the hospital is because of pharmacy and surgery. Please do remember, okay, the main revenue he has to maintain and he has to adhere to the safety programs, especially in case of certain things where unwanted things may take place in the hospital, like fire and all those things. He should become very safe to handle such pharmaceutical products in case of not proper storage. I mean, improper storage of the pharmaceutical products may again have a great problem. Okay, so he participates, he conducts a meeting and he adheres himself. He stick to the principles of safety program. Sometimes these safety programs, they have their own committees. Okay, they have their own hospital committees where pharmacist may be one of the member of safety program committee. To provide and to put into practice a program of continuing education for all professionals. Okay, he provides, and sometimes, many times it happens in the healthcare global hospital. I have seen personally. Okay, many times it happens in the healthcare global hospital and in big hospitals like Narayana Hrudayalaya Hospital, Fortis Hospital, and some other hospitals like Apollo hospitals. I have seen personally where pharmacist is a highly educated, like PhD scholar. He will be providing the drug information services to the doctors, interns doctors, or sometimes the MD practitioners. Okay, so he continuously has to update himself, then he has to give the education. Okay, continuing education. He has to learn continuously to be in a pace in the society. To participate and or facilitate all education programs which includes student experiences in the department. So he participates and he becomes like a facilitator for all education programs which includes student experiences in the department. He will take what all the experiences from the student. Okay, what has been taken from the hospital. Okay, and if there is any lacunae in between, he will clear that path. Okay, so it all tells about the education departments and the continuing education and continuing medical education or pharmacy education for uplifting their knowledge. To participate in and adhere to the safety programs of the hospital. Again, he will be sticking to the principles of the participation in safety programs of the hospital at all times. Okay. It may be clearly noted here that pharmacist also functions within this framework of the functions described above. Means what all the functions which has been enlisted here, he's always stick to the principles of all these functions which has been done by the hospital pharmacist. Okay, he has to maintain certain amount of dignity that is called as professional dignity in his field. Then only he can become the good pharmacist or highly competent skilled pharmacist. Okay. Now let us understand operational structure of a hospital pharmacist. Okay. Now here in this slide we'll be understanding how the operational structure of hospital pharmacist is there. Okay. How it is categorized and how it is made into different categories. How the operation takes place and how the operation structure which happens in the hospital. There are three things. Overall, hospital pharmacist can be categorized to be working in three major operational structures. One is drug distribution center, clinical pharmacist center, patient centered and integrated. Okay, so any hospital pharmacist can be working in three major operational structures. Okay, one is drug distribution center, clinical pharmacist center, patient centered and integrated. Okay, these are the three major areas of operational structure of hospital pharmacists. Always do remember. Okay, always you will be sticking to the drug distribution center, clinical pharmacist center, patient centered. Now we shall study and we shall focus on each of these one by one. What happens in drug distribution, what happens in clinical pharmacist, what happens in patient centered. Okay. Now coming to the drug distribution center, in this the pharmacists are primarily involved. Okay, here primarily involved in the distribution of drugs. He is primarily involved because the name itself is drug distribution center. So he is primarily involved in the distribution of drugs and processing of new medication orders. Okay, so he distributes the drugs. Okay, distributes the drugs and processing of new medication orders, the new medication. Okay, he processes it. So he processing new medication orders. Then he is not actively involved in development of therapeutic plans in this region. Okay, drug distribution center, he is not involved in development of therapeutic plans. This is some other area. We will see. Okay. So he does not actively involved in making the therapeutic plans for the patients. Hence, it is not accountable, okay, for the health outcomes of the patient. When he is not making any therapeutic plans, then he is not at all accountable for health outcomes of the patients. Now, next one is the clinical pharmacist center. Here, the clinical pharmacist center, there are basically of two types of pharmacist in the pharmacy department. Okay, one is the clinical pharmacist and other one is the distributive pharmacist. So clinical pharmacist will be having the two types of pharmacist will be working again in this area. Clinical pharmacist, clinical perspective, distributive pharmacist again, distributive perspective point of view. So clinical pharmacists are mainly involved in clinical activities, isn't it? Clinical activities, and they assist the physician and other healthcare professions. Okay, they are mainly involved in assisting the physicians and other healthcare profession, nursing profession, other healthcare professions in avoiding and solving. They avoid and they solve the clinical problems. Okay, they are involved in clinical activities. They avoid all the problems which happens in the clinical area. Okay, they accept little or no responsibilities for medication use or delivery systems, which is done by this pharmacist. Okay, they accept little or they don't have any responsibilities for the medication use or delivery systems, how the delivery is going on, drug delivery systems, okay. On the other hand, the distribution pharmacists are mainly involved in drug distribution process, reviewing orders, verifying the accuracy of the medications, preparations, which has been done by the technicians. Okay, there is not much collaboration between these two types of pharmacists. Okay, and so these pharmacists are selectively accountable for medication use process. Okay, these pharmacists are selectively accountable for medication use process. So again, in this area, in clinical pharmacist center, it is divided into two types: clinical pharmacist, distributive pharmacist. Clinical pharmacist in clinical activities, and distributive pharmacist involved in drug distribution process. Okay, so that words have been highlighted over there. Okay, and sometimes what happens, the distributive pharmacist may take the help of technicians, the pharmacy technicians, for medications preparations. Okay, and he will verify the accuracy. He will review the order. Okay, and lastly, we'll move on to the patient-centered and integrated services. Okay, last part is the operation structure. All the pharmacists in the department accept all the responsibilities pertaining to the medication use process, and therefore are involved in both clinical and distributive functions. Okay, so all the pharmacists have accept all the responsibilities during certain times, and they may become one, and the main area is patient-centered and integrated approach. They integrate with one another. Sometimes in the absence, they become distributive pharmacists. So they, each and everybody have their own specific roles, to be very specifically speaking with you. Certain times, these clinical pharmacists should know the principles of distributive pharmacist. Okay, it is like sometimes they may be posted in that area. Depends upon the hospital, depends upon the requirement again. Okay, so they may be involved in both clinical and distributive functions, and since well-trained pharmacy technicians are also involved in drug distribution, as I said to you. So the role of pharmacist is quite limited in this area, and hence they can expand their clinical roles to more active engagement like selection and use of medication, drug selection and use of medication. Okay, so here this role of pharmacist, what I am telling here, exhibit a high degree of ownership and accountability for the entire medication use process. They should be accountable. They should be having certain kind of ownerships, which where the entire medication use process is going on, they are responsible. They are accountable. They become like owners. Okay, which drug has to be kept. Okay. Now, let us understand what are the boundaries and interactions of the hospital pharmacy department. Okay. Now, we will see the boundaries and interactions of the hospital pharmacy. You can see the beautiful diagrammatic representation here. In the center, you just concentrate on the center here. Look at here. It's Department of Pharmacy, which is the core area, the main area. Okay. The Department of Pharmacy. And there are 6 things, 1, 2, 3, 4, 5, 6 things which is happening here. One is the hospital clinical staff region. So these are the services described above can only be rendered efficiently by setting up properly in a hospital pharmacy department. Okay. So there are boundaries and interactions of the hospital pharmacy. How it shows. This figure illustrates an abstract manner of pharmaceutical services, indicating boundaries of and interactions of the hospital pharmacy department. And several other departments and functions in the hospital. See, the hospital has to function, it has to have different departments with different specialty. The arrow represents interactions between pharmacy department and also the flow of information and the material. Okay. So, the hospital pharmacy, there is a department of pharmacy, hospital clinical staff will be there. They will be having a good coordination and communication between hospital clinical staff. Okay, one is going here and coming out. It shows have an interlinked or the interaction or integrated or communication between one to other department. Hospital nursing staff, again, they are linked with pharmacy at all times. Staff, they are linked, hospital nursing staff, they are linked with pharmacy at all times. Again, it's like give and take. Okay, they work hand to hand. Okay, hand to hand. Hospital, other departments. Other departments may be again a big list. Yesterday I told you, I have defined all the departments, whether it may be the laboratory departments, biochemist, microbiology department, they work hand to hand. Okay, sterile region, again, department of the pharmacy of its own, again, they work. Whether it may be the medical social service department, they work hand to hand. Hospitals committee, again, the hospitals will be having committee, again, PROs will be there, public relationship officers will be there. Again, it's like they work in coordination, well coordination. Okay, hospital administration, again, is a main thing where the drug and other things, the drugs and the pharmaceutical main revenue is from the drugs. Again, the administrator will work in coordination with the Department of Pharmacy at all times. Patient, of course, the patient, always they are very much linked to the Department of Pharmacy. Okay. What we have seen is the arrow represents, all these arrows represent interaction between pharmacy department and also the flow of information and the material, isn't it? Now let us move ahead and let us understand the suggested pattern of a setup of hospital pharmacy. Here we will understand the pattern, firstly, how the pattern works in hospital pharmacy, the hierarchy positions one by one. Okay. Firstly, you can see on the top ladder the director or medical superintendent, who is the chief person, who is the authority person to run any hospitals. He is the authority person to make the decision, or I should say he is a decision making authority. Okay. Nextly, we can see the director of pharmaceutical services, where PharmD, doctor of pharmacy, M.Pharm preferably with pharmacy practice. Earlier it was only M.Pharm with pharmacology. I should say it is only the PharmD and M.Pharm pharmacy practice are more towards that kind of service, because it is more over the clinical oriented service. Okay, the clinical oriented service, if M.Pharm pharmacy practice or with the combination of MBA, they do, definitely it will become a great thing, because that course is hospital oriented course. They are much more towards PharmD with MBA or M.Pharm pharmacy practice with MBA, rather than pharmacology is something the research arena. Nextly, the pharmacy in charge under Director of Pharmaceutical Services, PharmD or M.Pharm with pharmacy practice, there is the pharmacy in charge. And under him, there are different divisions will be working. At least it is classified into 5 types of divisions under pharmacy in charge. One will be the dispensing and distribution of drugs, where dispensing and distribution of drugs will be given by outdoor. If it is outdoor, it is again classified into outdoor and indoor. Outdoor, it is B.Pharm assisted by D.Pharm as a junior pharmacist. And indoor, again, it is B.Pharm assisted by D.Pharm as a junior pharmacist. So dispensing and distribution of drugs, there are 2 types of divisions again in dispensing and distribution of drugs. One is indoor as well as outdoor. B.Pharm, where the D.Pharm is like a junior assistant to the B.Pharm. Nextly, there is a manufacturing unit which comes under the pharmacy in charge. Here, the specialization is M.Pharm with specialization of pharmaceutical technology, because it is manufacturing. So these M.Pharma with pharmaceutical technology will be dealing with manufacturing aspect. Nextly, we can see the quality control procedures or quality control aspects. These will be taken care by M.Pharm with specialization in analytical chemistry. Especially speaking about analytical chemistry, and assisted by B.Pharm, one who is trained in microbiology and pyrogen testing. So a B.Pharm who has been trained in microbiology, he should have sufficient understanding about microbiology. He has skilled about the pyrogen testing. Okay, the pyrogen testing, how to test the pyrogen, and all those testings he should undergo training, sufficient training for 6 months, 1 year training. Then he can become the quality control officer. Along with M Pharma, he'll be a main person, and this the B Farm person is guiding, he's assisting the M Pharma for in case of quality control procedures. And there are drug monitoring services which are operating, which becomes a very interesting area. And the drug monitoring services and drug information services, it is the PharmD and M Pharma with specialization in pharmacy practice. Earlier it was only the M Pharma pharmacology, but I would say it is the PharmD or M Pharm pharmacy practice. They are giving the drug information services or the poison information services, or they can monitor the drug therapy. Okay, and they will make a decision whether any side effects has taken place, and they can change even some formulary based on the requirement. And lastly, that is the medical record section and miscellaneous duties, which will be performed by B Farm or D Farm. All the records, all the miscellaneous parts of the hospital pharmacy will be maintained. It has to be documented, and these B Farm and D Farm will be assisting the B Farm. So these records will be maintained. So in India, the records will be maintained by some commerce fellows, but in abroad scenario, these records will be maintained by B Farm, because the pharmacist, he is taking care of all record maintenance and all those things, the record activities, the management part. Now, having said that, I would like to take you to the understandable setup of hospital pharmacy. Already I told you, we have discussed about figure which shows in abstract manner the pharmaceutical services, indicating boundaries or interfaces between the hospital pharmacy department and other several departments, how it coordinating, how it is working together as a team, and how it functions in the hospital. Now let us understand and let us try to clarify our role, that is the functions and responsibilities, the role and responsibilities of the head of the department of pharmacy and his subordinate staff. What is their cadre, hierarchy, and their role in the hospital as a pharmacist. Now, functions and responsibilities of the head of the department. So we can see here inpatient or indoor pharmacist responsibilities. Again in inpatient and indoor pharmacist responsibilities. Again, functions and responsibilities of the head of the department and staff, they mainly stick to the principles of two. It is divided into two. One is inpatient or indoor pharmacist responsibilities, outpatient and outdoor pharmacist responsibilities. Firstly, we are seeing inpatient or indoor pharmacist responsibilities here. In inpatient or indoor pharmacist responsibilities, you can see central dispensing area. Second one, patient care areas. Third one, the direct patient care areas. And lastly, it would be general responsibilities. This is under inpatient pharmacist responsibilities. Coming to the outpatient or outdoor pharmacist responsibilities, again it is central dispensing area, patient care areas, general responsibilities. So what we have understood, we are trying to understand the functions and responsibilities, which I have prepared this graph accordingly. Functions and responsibilities of the head of the department and staff, two types, inpatient and outpatient. Inpatient, again it is classified into central patient care areas, direct patient care areas. Same thing, it is classified, but it does not have the direct patient care areas in outpatient because they are outpatients. So that is the classification. That is, now we will see and we will try to understand one by one the functions and the responsibilities, the role and responsibilities of the head of the department of pharmacy and his subordinate staff. Generally speaking, the head or the director of the pharmacy services has to ensure that the pharmacist functioning in different areas carry out their assigned functions and duties efficiently and is aware of his responsibility towards its staff. He should be aware what his responsibility towards the hospital. The following are the area-wise functions and the responsibility of the personnel working in the department. As I have covered inpatient or indoor pharmacist responsibilities, now we are understanding what is central dispensing area. To ensure that all drugs are stored, dispensed correctly, including the investigational drugs, to have controls of drugs stored and supplied from his section. He should check all these things. He should ensure that all drugs are stored and it is properly retrieved. Okay. Now, because storage, as I was telling you, the storage is one of the important criteria. It determines you whether how you have stored properly or not. Storage, if you are not stored properly, then there is a question of the product liability. Okay, the product degradation may take place without proper storage. So the storing of pharmaceutical products has utmost important. Is utmost important. To ensure all these things, it has to be stored and dispensed correctly, dispensed and distributed correctly as per the need of the physician, as per the instructions of the physician. Central dispensing area we are talking about to check the accuracy of the dosages prepared especially of intravenous admixture. What is this intravenous admixture? It is a combination of one or more sterile products added to an IV fluid. So you are combining one or more sterile products which is added to a IV fluid for administration. So intravenous admixture must be sterile and free from pyrogens. We are already talked about the pyrogens in the microbiology, in QC procedures, quality control and quality assessment procedures. Same thing, when you prepare large volume parenterals in the hospital, it should be sterile area should be there because you are injecting directly to the vein. So if the product is liable for contamination, you may see some of the dangerous consequences. So intravenous admixtures, when you prepare it, when you what I told you, it is a combination of one or more sterile products added to an IV fluid for administration purpose. So aseptic technique is used to mix the products. Aseptic technique is followed everywhere. Unit dose preparations, if practiced, unit dose preparations. Now the question comes: what is unit dose preparations? How do you define a term unit dose preparations now? Unit dose preparations, if drugs are packed as unit dose, it makes it easier and safer to administer the required dose. Each one of the capsule contains a single dose or unit dose of the medication. So if I want to tell about unit dose, a unit dose is the amount of a medication administered to a patient in a single dose. Single unit is single. So it's the amount of medication administered to a patient in a single dose. That is called to be as unit dose. So if it is practiced, many hospitals, they don't practice unit dose, according to me. If it is practiced and see to it that good techniques are followed and used in compounding all the preparations, especially the intravenous admixtures, because intravenous, again, you are directly pushing into the vein, and other extemporaneous products ordered for, you are pushing into the vein, and some of the serious consequences may take place if the aseptic technique is not followed, if they don't follow the principles of the aseptic technique. To keep proper records and preparations of bills, if any, record maintenance, to keep accurate records of patient's medication, in particular of the intravenous admixture and investigational drugs, bills for drugs supplied to discharge the patient section. So what I want to tell you here, some hospitals, understand, concentrate, some hospitals, they'll be having investigational drugs. Some investigational drugs are going on over there that has to be maintained. So record maintenance is very, very important for them. How much drugs has been used for investigational drugs? Bills. Which patient has been discharged now? how much investigational drugs has been used on the patient. Everything it accounts over there. Any undesirable side effects over there. To maintain professional competence, particularly that keeps himself updated with of information regarding any profession, he should always keep updating himself. Otherwise, see, I would like to give the example of the running water and the standing still water. Running water, you can drink it, but whereas the standing still water, we can't drink it because it is liable for contamination. So we have to become like running water. If you want to succeed in life, you should become like running water, like river. So you have to succeed. You want to become successful professional pharmacist. You should keep on reading. You should keep on understanding the new things, because the pharmacy is something always, the medical is ever changing science. Drugs current which are used in the hospital with special reference to their side effects, adverse reactions, drug interactions, therapeutic efficacy of the drug product, as well as their incompatibilities and stability of the pharmaceutical preparation. All these things will make the pharmacist more knowledgeable, and he will become like medication expert. Suppose the doctor, one example, if I want to quote, you have notified one drug which can cause cough, which induces cough. For example, ACE inhibitors inducing cough, and you have reported that this is the ACE inhibitors which is inducing cough. You can switch on to the ARBs, angiotensin receptor blockers, instead of angiotensin converting enzyme inhibitors. So you are telling all those things, whether it may be the small side effects or adverse effects. So you are preventing all those unwanted effects. You are minimizing it as far as possible, and you are increasing the therapeutic efficacy of the drug product. You are overcoming all the incompatibilities. You are increasing the stability of the drug by proper storage conditions. To communicate with all the pharmacy staff regarding new developments in the area, and you are assisting all those things, what the information you have gathered, you have read, to your subordinate staff or your junior staff, to ensure that new personnel in this section are properly trained in the policies and the procedures of the central dispensing area. You train them. You train the new policies which has been adopted by the hospital, or which has been adopted by the government hospital, whatever the hospital it may belong. You train the personals, and you give the all policies, and you list out the policies, and you the training to the person, and you tell the overall upliftment of the training and central dispensing area, how it performs, whether he may be a junior pharmacist. To coordinate the activities of the area with the available staff, to make the best possible use of personnel and resources. Within the limited resources, how you are making use the maximum benefit from the limited resources. To coordinate the overall pharmaceutical needs of the patient care areas with the central dispensing area, the adherence to the delivery of schedules. As per the schedule, you are coordinating all the pharmaceutical needs of the patient care areas. He has to ensure, the hospital pharmacist has to ensure all the laws and rules are applied to his section, and it is properly followed at all times. To ensure that the established policies and the procedures laid down are followed without compromising the rules and regulations. The central dispensing area should always be kept neat and clean and tidy. Now, let us understand the patient care areas, which happens in wards, which can happen, patient care areas can happen in operation theaters and other departments of the hospital, where drug of special categories are used. So patient care, everywhere the care of the patient has to be taken, which is the fundamental aspect. The pharmacist in charge of this section has many responsibilities to follow in case of patient care areas. To maintain a liaison with nurses, which has been told to you, who are involved in drug administration to patients in their charge. What the pharmacist does here, he reviews and interprets each unit dose prescription and if any intravenous admixture medication order, and he will assure that it is entered accurately into the unit dose or IV admixture system. So he understands that and he interprets that is there any chances of medication order is not followed properly. He also communicates with nurses and other physicians concerning medication administration problems. So nursing administration, medication administration, which is a very, very problematic area. He's a person who can understand these areas and he may guide the nurse and he may understand the compatibility. He will tell this is not compatible with this medicine. This product is not compatible. It is having some harmful consequences with this medical by assessing with with using the micromedics or some of the other softwares, and he will come up with thorough ideas and he will guide the nurses. He may guide the doctors in case of compatibility issues and in case of administration errors, nursing errors. Further, he assures the other supportive services maybe from any section, and he will ensure the correctly dosages, whether it may be the supply, whether it may be the central dispensing areas, or whether it may be the problem with medication areas are properly given or not. He reviews the drug administration in each patient periodically to ensure that all doses are being administered and charted accordingly. So whenever the drug administration happens now in each patient, we do ward rounds, the clinical pharmacist, and he is the person who is responsible now, who is held responsible administration, whether it is through IV route or IM route, dose is correct or not. So we follow the 5R principles, which will be told to you later. So rationality, whenever you speak about rationality, you speak about administration techniques. You speak about the transcribing errors, which will be told to you in coming slides. So all these things, whether the dosage, whether the administered, how much dose is administered, the administration route, properly it has to be written in the sheet that is charted. He reviews all the doses, whether it is any doses missed, reschedule the dose, or any changes in the treatment. He will notify to the doctor whether there is not given any missed doses, any reschedule has happened, or any drug is withheld. What is the reason for withhold? He will also assure that the new drug administration forms are transcribed accurately. When the transcription error may take place here, and the pharmacist is liable for that one. Okay, the pharmacist is held responsible for transcription errors. Even nursing administration errors may take place in the hospital. That he has to carefully look into it, so that there is no transcription errors. Transcription errors can happen when the doctor, senior resident doctor, when he's administering, when he's telling advice, this has to be given to the patient. This has to be given to the patient. When he's telling all those informations, and when a junior doctor is writing, he may write it wrongly. He may write drug name wrongly. He may write the dosage wrongly. So he has to prevent the transcription errors, transcribing errors. Further, he confirms periodically every time he goes to the ward round. He does the ward round participation with the doctors, nurses team, and he will check that each administered dose are correctly noted on the chart, patient chart, and he will assure that records of the properly it has been maintained, especially in case of narcotic drugs and psychotropic substances. So he has to maintain all those records properly in case of the some of the very stringent actions has to be taken, and some narcotic drugs are there. It has to be kept correctly, and that physician is informed of all. If something goes wrong, the stop orders has to be initiated immediately. To provide instruction and assistance to the junior pharmacist as and when required, dealing with difficult patients and the new procedures. He assures that the junior pharmacists are in communication with the nurses regarding about proninata. So prorinated drugs are those which are when and as and when required. So these drugs, again, the pharmacist has to assure that the patient the patient has to come with prescription. Otherwise, it is clearly written as it is PRN. In case of outside pharmacy, we are talking about the hospital pharmacy. So only prescription drugs have to be sold by the pharmacist. So he has to have the proper coordination with the junior pharmacist, nurse, and medical personnel in PRN drugs. Further, he assures the proper drug administration, and it is carried out with the principles of the standard guidelines. And junior pharmacist, how he has to train about policies and new set of rules as framed by the hospital or particular government hospital policies. He also makes sure that adequate junior pharmacist coverage is provided in the patient care areas, and also takes steps to train the new junior pharmacist. He will coordinate overall pharmaceutical services, whether it is running as per the unit level. Means there should be coordination and there should be hand-to-hand operation. He also ensures that junior pharmacists keep unit medication areas neat and orderly, and proper security is maintained in the medication areas to prevent thefts or pilferages. So sometimes theft may happen in hospital. So he has to maintain that some sort of security. Okay, breach of security is not at all advisable. Now coming to the direct patient care areas. In these areas, the pharmacist's responsibilities include identification of drugs brought into the hospital by the patient, obtaining patient's medication history and communicating all the information to the attending physicians, to assist in the selection of drug products and their identities. He also assists physicians in selecting dosage pattern and schedules and assigns the timings for drug administration, to monitor patients' total drug therapy for effectiveness, whether drug is effective or whether it is not effective. Side effects, any side effects have been notified, or any side effects have been seen in the patient. Any signs of toxicities has been experienced by the patient. Allergic drug reactions, drug interactions, and as for the distribution and concentration in the organs and tissues by pharmacokinetic and pharmacodynamic methods. What we do by checking in the software, we analyze the drug. We make and we come to the conclusion that this is the drug which is causing this side effect. This is a drug which is causing this toxicity. Better to withhold and start some other drugs, some other alternatives. So the pharmacist, he is generally called as drug experts. So in coming area, when we have adopted the modern system of medicine, definitely they have to, there will be side effects, there will be toxicities, there will be drug ineffectiveness will be there. To overcome all these problems, he has to depend upon the clinical pharmacist. The medical staff has to depend upon the clinical pharmacist. Counseling points on medications which are to be self-administered in the hospital. What are all the counseling points regarding the use of discharge medications? Now, the pharmacist is the person who will tell how to use the medicines which has been after discharge, hospital discharge, how it has to be used. So conversion from IV to oral dosage will be there. So he has to tell the patients and he has to make their ambiguity and he has to clarify all the doubts of the patient regarding about the use of the drugs. Participating in cardiopulmonary emergencies by procurement and preparation of drugs needed. Charting all the medications given, listing all the medications given, performing cardiopulmonary resuscitation if necessary. So a broad pharmacist, there is a pharmacy after PharmD, they do emergency clinical operation services, or it is called, they are called to be as emergency clinical pharmacist, who are well versed in all these emergency procedures. They are called to be as board certified emergency pharmacist. I should say they are learning 2 years of emergency preparations or disaster. They are expert in giving the ABC of the cardiopulmonary resuscitation or the first aid techniques. in case of emergency situations like myocardial infarction, but we tell it as heart attack. Okay, he should know how to give the first aid, the principles. Again, he has to use certain drugs. He should know which all the drugs are required for in such a certain emergency conditions. What the dose? What is the drug? Coming to the general responsibilities, to provide in-service training and education for the pharmacist and pharmacy students, nursing and nursing students, physicians and medical students. He has to provide information regarding about drugs to all. Now coming to the outdoor pharmacist, what we are seeing is the indoor pharmacist. And indoor pharmacist, what I told you, again it is divided into 3 types, but we have covered 4 types we have covered: central dispensing area, the next one patient care areas, and direct patient care areas, and general responsibilities. Now we are covering the same which is meant for outdoor pharmacist responsibilities. These responsibilities, again, it is divided to 3 categories. Those include the central dispensing area, patient care areas, and general responsibilities. They are almost similar to what we have described the preceding section. Now coming to the central dispensing area, the pharmacist ensures that proper techniques are used in extemporaneous compounding of the drugs preparations now. So extemporaneous compounding, here is the preparation where the drug is specially prepared by the pharmacist because an appropriate drug is not readily available. So he's preparing those methods and he should see to it that it is properly followed, properly prepared. Provides for adequate record keeping and billing in respect of patient's medication particulars, records of investigational drugs. Same thing as we have seen in the indoor patient responsibilities. Records of outpatient bills for the charge of services and material furnished by the department, and the most important, maintenance and preparation of all reports, correctly maintaining prescription files. Keep the outdoor pharmacy in a neat and tidy manner. Coming to the patient care areas, to periodically inspect the medication areas on the nursing unit and to make sure that they are always kept adequately supplied with drugs and other articles whenever required. To identify drugs brought into the clinic by the patient and record the patient's medication history and communicating the same to the physicians concerned. He also assists them in selection of drugs regimen and schedules and selection of correct dose products and their entities. Pharmacist is mainly involved in monitoring of drugs as explained earlier. To counsel the patients on proper use of their medication and prepare the medications for intravenous administration. Coming to the general responsibilities for outdoor patients, because we are talking about outdoor patients now, the general responsibilities we are talking about. Here, in case of general responsibilities, to coordinate overall pharmaceutical needs of the outdoor service area and exercise adequate control over such drugs. To ensure that all drugs are handled properly, such as storage of investigational drugs. To participate in cardiopulmonary emergencies in the manner described earlier. To provide for in-service education and training for pharmacists, pharmacy items, and the pharmacy students. So, we have covered a very detailed topic today, and let us summarize all the things. Okay, let us summarize all the things now, what we have covered within a span of time now. So, what we have covered, hospital pharmacy is the department, service, or a domain in the hospital organization managed under the under the pharmacist, chief pharmacist, or he is called as competent, professionally competent, legal qualified pharmacist. Pharmaceutical services in a hospital include many things what we are told. Pharmaceutical services we'll be talking about now, which includes many things now. So dispensing of drugs and medicine, management of the stores, manufacture and distribution of medicaments and products we have talked about in detail, providing therapeutic drug monitoring services, to obtain the efficacy of the drug product by TDM, Drug Information Center in the hospital, patient care areas by providing counseling, nursing department and to take care of sterile drug supply, participate in teaching programs to educate the junior pharmacist and intern doctors, nursing staff, maintain the liaison between all the medical professionals. This is the pharmaceutical care, pharmaceutical services given by the pharmacist in the hospital. Then we have covered up the functions of the hospital pharmacy, which is very, very detailed aspect. We have covered what all the functions which is covered by the hospital pharmacist, whether it may be the pharmaceutical services, what we have told, and the plan for hospital pharmacy administration. We have already talked about that thing, establishing the liaison, what I have told now, and to estimate the requirements for the department and enforce the policies or the certain rules and regulations. We have talked about that thing, to maintain the record and reports, okay, proper maintenance of inventory, and then control stocks, dispensing and other manufacturing of the medicaments. Then we have seen the operational structure of hospital pharmacy. Then we have seen the suggested pattern of setup of hospital pharmacy. Finally, we have tried and we have understood the functions and responsibilities of the head of the Department of Pharmacy and his staff. Okay, that concludes the hospital pharmacy and its organization. Thank you. Now we shall move on to the suggested pattern of a setup of hospital pharmacy. Okay, this is a suggested pattern of a setup of hospital pharmacy. Now we will understand that thing.